the secret is just don't give up, man. And it sounds so cliche, but it's the truth, man. Don't quit. If you ask me what my definition of success is, it's just getting up one more time than you fell down. That's it. Dust yourself off, you know what I'm saying?
Yep.
Bandage up them wounds and then keep going. Put one foot in front of the other. Keep getting up.
How's it going, guys? Welcome to another episode of Secrets of Silent Success. Today we have the one and only Dr. Emmanuel Fasanya. How you doing this afternoon?
Man, I'm blessed, brother. I can't complain one bit, man.
Cool.
Yeah.
Thanks for having you. So we'll jump right into it, right? So you're the owner of the only Black-owned physical therapy clinic in Dallas. Tell me a little bit about your journey.
Man, you know, it's unfortunate, but it's true. The higher you go, the less you see of you.
Yep.
In my class, it was probably like 2 other Black guys out of like 60 students. So it was tough, you know, so me and my roommate kind of stuck together and really had to just lean on each other throughout the whole entire program because nobody kind of really came from where you came from or related to you in that, you know, in that aspect. So, well, of course, we're all related as far as we're students, we're coming in for our first time and had this rigorous program, but nobody really came from where you come from. Like, I'm the only one, you know, around in my circle, you know, that's doing what I'm doing. So who am I going to lean on? Who am I going to talk to about what I'm doing? So it was interesting. It was different, you know, but you know, we're here, you know, we're here. So, and then even getting into school, you have to do different shadowing hours and things, you know. Some of my classmates like, oh, I just asked my aunt or my uncle, or they had a friend. Me, I had to figure it out to find a physical therapist where I could do shadowing hours and kind of figure it out all by myself. Because I don't know if you know, but with physical therapy, there's only a few schools in Texas, and now there's more. Back when I was, it was probably like 4 or 5 schools, and they each accept a cohort every year, once a year, and they accept about 50 to 60 students once a year. But you have 500 to 1,000 applicants a year, so it's very tough to get in. I didn't get in my first try. But I went back, I revitalized what I did. I only applied to 1 school my first try. Next time I applied for 5 schools. I went on what I called my physical therapy tour. I went to Texas State, UT Health Science Center, different places, San Antonio, Houston, you know, like San Marcos, Dallas, Fort Worth, and just to shake somebody's hand and just let them know, hey, I'm not just an application, I'm a face, and I actually have a passion behind this field. And I feel like that helped a lot, going to get more shadowing hours, going to just really kind of telling my story and my letter of intent, different things like that helped out the second time. And I was fortunate to get into TWU Houston in the medical center. So it was a blessing. It was one of the top schools in the state too. So it was a blessing, man.
All about differentiating yourself.
Exactly.
Gotcha. So not only are you focusing on the medicine side of physical therapy, you're also going into the entrepreneurship route, opening up this beautiful facility. Tell me why entrepreneurship? Why start your own thing?
Well, you know, I am Emmanuel Fasanya Jr. So my dad, I'm from Nigeria, man. So double minority, you know. But my dad, he had his own medical practice in Nigeria, in Lagos, Nigeria. So when you come here from another country, they kind of make you do everything all over again. They still respect you as a medical doctor, but you're as if, so let's say you've been practicing for 20 years in another country. You come to America, you're as if you just graduated medical school in their eyes. So you have to go through residency again, fellowship. He started that, but he had kids, you know, he had, you know, a wife, and it was a lot of, you know, as MD students know, it's very rigorous. So it's a lot of time away from the family that he's built, and he was a well-seasoned OBGYN at the time. So he stopped that, he opened up his own business called Alliance Career Institute. So it kind of, I guess that, you know, we share the same blood, share the same name. it came into me to, I guess, that have the entrepreneurial spirit.
Yep.
And I wanted to do the same thing. I wanted to start my own thing. It didn't start off with Elite Alliance. I started a little bit smaller at first, and then it blossomed to this. So.
Got you. Tell me about that blooming process, right? We're in the new facility, Elite Alliance, just opening pretty recently, right?
Yeah.
So tell me about the journey to getting here from where you started.
Man, I'm not gonna lie, I started pretty quick, man, after school. So I graduated May 2019. Okay. So after, when you graduate, you got about 2 weeks to celebrate, you know. You know, because it was tough. You know, I saw by the grace of God, I graduated, and then once you graduate, those 2 weeks, it's time to study for the boards. You got the boards late July. So the boards are, of course, the exam you have to take to be able to be licensed to practice in the state. Sure. Just because you graduate doesn't mean you can practice. Yep. So once those 2 weeks were up, I had a schedule. I was studying 8 hours a day. When it got closer, I started doing 12 plus hours a day. I cut off everything, Instagram, friends, everything, just locked in and focused. And I went into this mode to where I'm like, man, I kind of tapped back into that mode to even come here and do this, because when you get into that mode where you're so locked in and you're focused on a goal and all the energy around you is focused again to that goal, there's nothing that can stop you. You're gonna do it. Yep. So like, I kind of took that same mentality when I graduated from the residency program. And kind of during the residency program, I was kind of helping my friends out. Hey bro, my shoulder's hurting me, my knee, my back. So I was practicing some of the things I was learning in the residency program on my friends. I started seeing some of the other therapists, let's say after a patient is done with rehab, but they kind of still want to continue. Some of the therapists were seeing them one-on-one outside. So I was like, you know. So I started off just helping my friends, you know, and I was just kind of helping my friends outside, helping them with their knee pain, and it turned into a business. So I started My Concierge PT back then in 2020. And it's funny, I started Elite Alliance Physical Therapy too. I created the LLC just because it was my idea. I just created an LLC, just made it real. Get it on paper. I got on paper, got my boy Cosmo to do the logo and everything like that, make it real. And then for My Concierge PT, I want to just be able to help more people. People were asking me, do you accept insurance? I'm like, nah, no, I'm just doing cash right now. One-on-one, you know, during the pandemic, people didn't want to leave their house, so it was good. So from there, I want to, like I said, help more people get in contact with these orthopedic surgeons, being able to, and most of their patients are insurance, you know, so I was like, okay, I need a place, man. So I started looking like end of 2020, going into 2021, looking for a place. I was like, okay, let's do this. Let's make it real. And I didn't have the money. All I had was the logo and the LLC and the vision and the faith in God that I knew that he was going to do this for me. So we were just looking at places, and my friend and now my business partner, Taylor Gabriel, he just retired a few months ago from the NFL. He was trying to, all right, just this place is cool. Let's just get this. I'm like, nah, it's not it. Something had to just like speak to me like, this is it. I didn't know what I was looking for, so it's hard to describe, but I just knew what I wanted at the same time. I knew it was gonna speak to me. I was driving down the highway here in the medical district. I was like, hold on, what is outside this little shopping center? Busted a UE, came in here, was looking through the windows, and I said, this is it. Wow. I didn't know how much it cost. I didn't know how I was gonna do it. I had some money saved up from stuff, but I knew it wasn't enough to start a business, but I just went on faith. And with that, you know, little money I had saved up, I had like 20, 30,000 saved up. And I said, that's a lot of money, but it was like, it's little money compared to how much it costs to do all this, you know, but I was able to, you know, sign my lease and, you know, find a place, sign my lease, get it, and boom, almost all the 20,000 was gone after I paid the deposit and the first and last month's rent and all that. So, but then I was blessed with, you know, more funds going through that. But it was a long process, a long journey, and that's how I knew I was just in alignment with what God's purpose was for me. Because everything I needed, it was supplied to me. It was through trials and tribulations, but it was just supplied to me. And that's how I knew I was just being obedient and doing what I was supposed to do.
So you're also a direct access provider. I'm saying that right?
Yes, sir.
Where a patient doesn't necessarily need a physician referral to come to you. Talk to me about that business model and how you're able to get patients.
So so we could get patients from a whole bunch of different angles. So Of course, people can be following us on our social media page, follow us on Google, just heard about us, word of mouth.
Sure.
And they have knee pain right now, and they can't get in to go see a doctor to come check out their knee pain just for them to send them to physical therapy anyway, because they know it's not bad enough to operate on it, or back pain or shoulder pain, neck pain, whatever it may be. It's not bad enough to operate on it, so they come to a physical therapist. Physical therapists are we are the specialists when it comes to the musculoskeletal system as it relates to movement.
Sure.
We are the go-to provider, because the surgeon, if they're not going to operate it, all they're going to do is what? Give you some medication that's going to mask the pain, but that damage to the soft tissue, whatever it may be, is still there.
Yep.
So what they do is they send them to physical therapy so we can rehab them and get them better to hopefully avoid surgery.
Sure.
So in the state of Texas, they could come to me, and we're a partially direct access because we get 15 days to treat somebody. A lot of times I can get people better in that time, but if it's a more serious thing, they need more than that. Then that's when I would send them back to one of the sports medicine doctors or orthopedic surgeons we have in our Rolodex, and that we have good relationships with.
Sure.
And they evaluate them like, okay, no, you don't need surgery, but I do recommend that you need to continue on with physical therapy.
Gotcha.
And then they come to me. But we also do see people post-op, surgical, so after their ACL, patella tendon, Achilles, rotator cuff, back surgery, whatever it is.
Rehab type.
Yeah, so for instance, you cannot have surgery without the rehab.
Yep.
You can't. It doesn't. So orthopedic surgeons, physical therapists, we go hand in hand.
Sure.
Which leads us to the name Elite Alliance Physical Therapy. So it's a alliance between the elite practitioners, the elite orthopedic surgeons, and the elite physical therapists to join together to provide the best level of care for the patient. So that's how I have the name. So we go through these, we only look at the best sports medicine doctors or the best surgeons to build a relationship with, because I feel like I'm one of the best at what I do from my training and my experience that I had with working with professional athletes. And the general population as well, and my residency training. So it made me feel confident to be able to go out on my own and work on my own. I'm still learning. I still study every day. I learn from other therapists. I'm not saying I'm, the end all be all the best. If you stop learning, you stop growing. So I learn from my colleagues. I still pick up the phone and call my mentors. Nora, Adib, those are my people. Like, I'll call Austin. I'll call them and like, hey, I got this ACL. What would you do at this level? If you start to get too cocky and think, oh, I'm the best, I don't need, that's not, you're not gonna grow. You're not really doing what's best for the patient, So I always wanna encompass everything, what's best for the patient. So so we have all kinds of ways to where we can see people, whether it's post-op surgical, they're coming from a physician, or they're just walking in off the street or heard about us or saw us on Google or Instagram, Facebook, whatever, and then they want to get these services. So
So you talked a little bit about walk-ins, word of mouth, social media. One of my favorite phrases is you don't have a business until you have someone to pay you for what you do or what you make, right? So I know we talked about the medical side of it. Let's talk about the business side of it, right? How are you, growing your business? How are you marketing? How are you getting more people through the door?
Things like this, like getting the word out, a lot. And we've been open for, this is Thursday, this is our third full week that we've been open, man, and it's been beautiful.
Paint's still fresh.
Man, paint's still fresh, for real. We still got equipment coming in and stuff. But we have just word of mouth has been amazing. I've been doing a lot of work on Instagram, social media. My social media has been amazing. Wendella, follow her on Instagram. She's been amazing making reels. She's been making our flyers, anything that you see, our website, just making it modern. It's been amazing. So like that social media presence has been awesome for us. And then my partner and I, Taylor Gabriel, like I said, he just retired. So it's that credibility from a professional athlete. And he wasn't one of those guys who just played in the NFL. He was a starter all 7 years. He went to the Super Bowl. He has the Super Bowl. You go YouTube Taylor Gabriel Super Bowl. You'll see what I'm talking about. And that highlight is cemented in Super Bowl history. So getting him to walk into these orthopedic surgeons, like I said, we're going for the best. And here I am, this young African-American guy walking in this clinic and saying, hey, best surgeon in Dallas. Send your patients to me. And they're like, who are you? Why should I, I'm sending them to the big Baylors, the, the Methodists, who is this Elite Alliance Physical Therapy? Well, I am this person that has been working with this athlete for this many years and he trusts me, so should your patient. So walking into these places and they provide me with, he provides me with that credibility that, wow, if you work with this guy, you work with all these other multi-million dollar athletes and they trust you, I think John Doe from 45-year-old knee pain I can trust you with, you know what I mean? So that's how the credibility. So we went to, man, you name a doctor's office in Dallas, we've probably been in it, knocking at the door, just trying to get some patients. Even if they send us one patient, that patient will come back singing our praises when they have their follow-up visit. So that's kind of thing. If you send us crumbs, we'll take it and we'll build a cake with it. You know what I mean? So it's okay. I eat off the crumbs right now because sooner or later you're gonna be giving me the whole cake. So we want to be able to provide that level of care so that's our model. I didn't even say that. So our business model is to give the general population the level of care that these elite athletes are getting. So when it comes to things like the technology we have in here, like the win-back technology, where it's getting down to a cellular level, make the cell wall more permeable so the nutrients can get in there, and we're speeding up the healing process, to the CureWave laser. It's a class 4 laser, the most powerful laser on the market. It's not something you can walk in the store and just purchase. So you're seeing a lot of other lasers. 9 times out of 10, it's not it. It's not the same laser that we have. And these are the things that are in NFL training staffs, NBA locker rooms training staff. And now anybody can walk off the street and be able to get that same level of care right here in Dallas Medical District. So these things are working to get people better faster. No, we're not trying to rush anything, but people they're trying to get back to work. They're trying to get back to being able to play with their kids. They're trying to get back to be able to work out with their trainers, to be able to get back to playing their rec league basketball or whatever, So these people need to get back too. Why is it that only professional athletes get this level of care? Why can't the general population get that? So that's what we have here, even down to our recovery room. We have the Normatec boots. We have the Game Readies where it's compression and ice. We have, all kinds of things from hyper ice, vibrational for the back, just feel good stuff for after we do some tough rehab. You could come in there and get some recovery and, so we have that wellness side as well as the medical side as well. So, and that's available to everyone. So that's my favorite part. And my partner, Taylor, he just loves giving back. How can he come back to his community and give back and one of the things we have now is, all right, the things I'm using to get better after all the injuries I've been through, now you have the same thing. So it's been beautiful being able to give that to the community, man.
So we've talked about a lot. We talked about having the NFL credibility. We talked about the beautiful equipment that you have here. But what is you all's biggest differentiator when talking about other physical therapy groups?
Man, look at it. I mean, just the way with the aesthetics, we have amazing interior designers. Monica and Raven, King Concepts, Sanford Home Designs. So both of them came together and I had a vision and they brought it to life, man. So also HD3 Realty, this was nothing in here. We came from ground up and they designed. HD3 Realty does custom homes and does commercial projects now. So they came and they brought this vision to life. So we tried to make this look like some kind of sports facility or a gym almost, if you will, but it's a physical therapy clinic because we didn't want, people are trying to get back to this setting, And typically when you go to physical therapy, they're dragging oh man, I gotta go to PT today. But people like coming here, man. They like the aesthetics, it smells good, it feels good, We have the same air purifiers that are in luxury hotels. So we want to make this luxury type brand in here to where you don't feel like you're in a clinic, you're in a gym. And then that's one thing, just the aesthetics. And then secondly is the equipment that we have here. 9 times out of 10, you're not gonna find the CureWave laser in a physical therapy clinic, the win-back, or I didn't even mention this, we also have the hyperbaric oxygen chamber. So if you Google, YouTube that, you're gonna see LeBron James using it, Tom Brady. That's the athletic side, but you see Justin Bieber using it, Kylie Jenner for anxiety, Justin Bieber to help get into a deeper sleep. Tom Brady, LeBron, they're getting up there in age, but why? They're still performing at a high level. They need that recovery, so it kind of resets their body when they're in there. They're in there for like 60 minutes minimum, getting in there. It helps with increase your healing times. It helps with decreasing inflammation. It helps with healing overall. Like you just had surgery. You just had even girls that are getting BBLs and all that stuff. Like it helps improve the healing of everything. So, so we have the hyperbaric oxygen chamber. And these are things that are not covered by insurance, but they still are cash paying. People are paying for it because they feel the difference. So just by going to the recovery room and having the access to this technology, coming in here, looking at this aesthetics, and then having access to a residency trained physical therapist who has had advanced training, hands-on techniques. I'm dry needling level 2 certified. So they're getting everything all in one roof. So we have a slogan, I have it back there. We have Dallas logo and our EA logo in there because we are trying to be Dallas's physical therapy clinic. And there truly is a difference. So our like hashtag logo, there's a difference. Because when you come in here, you really feel that like this is different from any other physical therapy clinic I've been to before. We've had multiple people, bulk of people that we have in our caseload that have transferred from other clinics, and they're working there. Let's say it's a patellar tendon thing, and they're like, "Man, you're really making sure I do all 10 reps, son, and I'm doing them correctly." Typically, other places they're like, "All right, 3 sets of 10, all right, cool," and then they're walking to their other 3 patients they have, within that 1 hour. So we're here, you're getting some personalized care, you're getting the technology. Shoot, you might get Taylor Gabriel in here, working with you and checking you out, making sure you're doing what you're supposed to do. So that's definitely different from any other place here in Dallas for sure, even the state of Texas, honestly. So we're excited about the growth. Like I said, it's only been 3 weeks, but we're excited to get this out to the public and let them know that, hey, this exists, so. It's cool.
That sounds super awesome. So this is called the Secrets of Silent Success platform. So we were talking a little bit off camera about your journey to get here, whether it's in school and things like that. So tell me a little bit about your journey and what's your secret to success.
Man, the secret is just don't give up, man. And it sounds so cliche, but it's the truth, man. Don't quit. And don't quit doesn't mean just keep doing the same thing over and over and then failing over and over. That's insanity. That's the definition of insanity, doing the same thing over and over and expecting a different result. But it was trial and error, man, from undergrad, I had from my first semester at UNT, I'm gonna tell y'all, I had a 1.384 GPA. You heard me? But look where we at right now. You know what I mean? 1.384 GPA. And I had that decision to make, like, okay, are you going to fold or are you gonna stand 10 toes? Which one are you gonna do? Because at the end of the day, your parents can tell you all this, your friends can say this, your family, but it's gonna be your name on that degree. So what you gonna do? And I decided to make that decision as a man, like to become a man. That's when I joined Alpha Phi Alpha Fraternity Incorporated, and I had to get my GPA up to join that, of course. I couldn't, my football dreams died, but I found physical therapy. So I was majored in kinesiology in undergrad, and I just started grinding, man. I started applying myself. The first class that I figured out that, maybe you could do this was anatomy and physiology. That is a weed out class in undergrad, actually. It's a weed out class. Like, are you gonna go this medical route or are you gonna do something else? And I was getting A's, like, dang, hold on, wait, I'm getting this, I got this. So I just had to just apply myself, but I'm a social person. So I'm not gonna say I, neglected the social side, but I came up with a program called the Work and Reward Program. So there's a way to where you could grind and you can still have time to enjoy. Like, people feel like grinding means, oh man, I'm staying up to 3 a.m. studying. But what you doing the other, hours of the day? You know what I mean? So you can find pockets of times in the day to where you could get some studying in. So I used to do mine, all right after class, I'm gonna get some studying in. Then I'm gonna go to my next class, or right before class, I'm gonna read for an hour about the lecture that we're about to have so it sticks. And then so I read it before class, I hear it in class, and I study right after class. It's gonna stick a lot faster, you know what I'm saying? So I started doing that, A's, but it's hard to bring that GPA up, man. It's tough. So even after undergrad, after I brought my GPA up, I had to take some classes, prerequisites. I didn't get in my first time, like I said before.
Sure.
Took more prerequisite classes to boost my GPA up. I talked to these advisors at the PT schools like, hey, I know I got these grades and these classes that I need to bring up. Which one do you recommend that I should do? What would you like to see? What hours and what settings would you like to see? That way, I'm not working harder necessarily, I'm working smarter. You know what I mean?
Absolutely.
So that's what I did to kind of separate myself. I'm talking to these people. I'm on the phone with them. I'm emailing them, kind of bothering them. But they remember my name, you know what I mean? So I had to do all that to get into PT school. And that's really the hardest part, getting in. I told you about that. But then I went to TWU Houston. And if you look at the average GPA of my classmates, it was a 3.9 getting in. Wow. So everybody were brainiacs. I had people that never saw a B before in their life getting into school. Wow. Versus me that had that GPA before. It's another way about relating. Yeah. So it was tough, when classes was tough, but you can't be afraid to ask for help. Can't be embarrassed by it. You just got to do whatever you got to do because everybody's trying to survive. So even with school, I had some trouble with school and everything in PT school, but I just leaned on my classmates, leaned on my friends, leaned on my family, and I was able to get through physical therapy school and pass my boards on the first time with that heavy grind of, you can't play around with it, to, finishing residency and then starting businesses and getting to where we are now. But success is not a linear path. You're gonna fall, you're gonna stumble, you're gonna scrape your knee, you're gonna hit all kinds of roadblocks.
You're gonna need some physical therapy on your way to success. For real, you're gonna fail, you're gonna need to work that knee out. Yeah.
Man, but I'm telling you, bro, just don't quit. You have a plan and you just stick to that plan, keep going. And when one thing fails, revitalize that plan and just keep putting one foot in front of the other. Like, if you ask me what my definition of success is, it's just getting up one more time than you fell down. That's it. That's it, because you're gonna fall. People think when they fall, oh, it's over, I quit, I suck, I'm not. Man, stop feeling sorry for yourself. Dust yourself off, you know what I'm saying? Bandage up them wounds and then keep going. Put one foot in front of the other, keep getting up. Even when you get to that level of success, it's still a grind.
It is.
I haven't done nothing yet. I mean, people feel like, oh, you open up your own clinic, you there, man. Like, man, my goal wasn't to open up the clinic. My goal was to flourish. My goal was to, have my bills on auto pay, have my parents' bills on auto pay, take my family on vacations, provide for the needy, you know what I'm saying? Buy my wife a house and, jump in a lamb truck, that financial freedom, that's my goal, so we're just getting started, man. So I'm excited for the journey, man. I'm excited.
Cool. So where can we find out more about you?
Oh man, let me look at the camera. I want everybody to be able to tap in. If you're looking for physical therapy, you don't have to be old. You don't have to be an athlete to come here. If it hurts when you move it, we do it, man. So follow us at Elite Alliance PT, at Elite Alliance PT on all social media platforms, Facebook, Instagram, and our website is also www.elitealliancept.com. So you could book your appointment there. We do wellness, we do medical, we accept insurance, we accept cash pay. So if you need us, call the front office. Look us up, man. Look us up on Google, leave us good reviews, whatever, man. We're excited to serve the community. Yeah.
Cool. We're going to leave it there, brother. I appreciate you. Look forward to doing it again sometime.
Love.
Absolutely.
Yes, sir.